Well, good morning, everybody, and welcome to your newly expanded Milton District Hospital. Woo! I don't know about all of you, but I think this is a pretty terrific way to start a Friday. And what do you think of the hospital so far? For those of you that I haven't had the opportunity to meet yet, I'm Denise Hardin, and I'm the President and CEO of Halton Healthcare. And I am very privileged today to be your Master of Ceremonies for this very special and long anticipated event. So welcome again to all of you. And joining me on the stage this morning, we have a number of very important delegates, and we are so delighted that they took time out of their very busy schedules to be here with us for this special occasion. So first of all, we have the Honourable Kathleen Wynne, who you all know is the Premier of Ontario. The Honourable Eric Hoskins, Minister of Health and Long-Term Care. The Honourable Indira Naidu-Harris, who has a number of titles. She's not only MPP of Halton, but she's also the Minister of the Status of Women and the Minister responsible for early years and childcare. Welcome, Indira. Gord Krantz, Mayor of the Town of Milton. Mr. John Nyholt, who is Chair of our Halton Healthcare Board of Directors. And Dr. Lauren Martin, who is our Halton Healthcare Chief of Staff. This is truly a momentous day for our organization. It's hard to believe we are finally here, but in 48 hours, we will be closing the existing emergency department on Bronte Street South and opening our fabulous new emergency department off of Derry Road, as well as opening our new entrance to our maternal newborn department. And at 8 a.m. on Sunday morning, we will begin to move patients from the existing facility into their new spaces in the med-surg units, in the intensive care unit, and in the maternal newborn area. So it's going to be a very exciting day for not only Halton Healthcare, our patients and their families, but our community and the entire town of Milton. This whole event marks the completion of a journey that began longer than a decade ago, and I even date it back to about 2002, which for me is about 15 years. At that point in time, John Oliver, our then CEO, and our board of directors set about planning for future expansion of this site to meet the growing needs of the community. You may not be aware of this, but the first hospital was built in 1959, and that hospital was meant to serve a community of about 3,500 people. Then the community got together and raised money to expand the existing facility. So in 1987, opened the expanded wing. And at that time, in 1987, the thinking was that this hospital would be designed to meet the needs of a community about the size of 32,000 to 35,000 people. So today, here we are, 30 years later, about to open a 330,000 square foot expansion. And I thought it was designed to meet about 120,000 people, which I thought was the current population of Milton. But Mayor Krantz always takes the opportunity when he can to update me. And so in the short week from when I got my stats, he's now telling me Milton is 130,000 people strong. So this building that we're in today is a credit to a small army of people who left no stone unturned, who worked tirelessly to achieve our vision to transform the community hospital experience. So from groundbreaking to substantial completion, through operational readiness and facility activation, and now finally to opening day, you have supported us and we have delivered. Have we not delivered? And I would be remiss if I didn't mention my 5 favorite words. Halton Healthcare, with the delivery of this project, is wrapping up a trifecta of $3.36 billion of new healthcare infrastructure, starting with a 14,000 square foot emergency department in Georgetown, a small 1.6 million square foot brand new build of Oakville Trafalgar Memorial Hospital, and this 330,000 square foot expansion. And my 5 favorite words are, all of them were on time and on budget. This is a story we're very proud of. Bringing this Milton District Hospital expansion to life took a long journey with a lot of players and a lot of community support. So we have a little vignette to show you just to demonstrate how many people it takes to expand a community hospital. So I hope you enjoy it. Roll vignette.
It all began in 1959 when we first opened the doors to Milton District Hospital. Back then, the hospital served a community of just 6,000 people. As the years went by, the new 401 highway and more water service created the conditions for Milton's growth. And grow we did. By 2011, Milton was the fastest growing community in Canada, with more than 84,000 people calling it home. Our hospital was feeling the pressure, challenged to meet the needs of our ever-expanding community. The need for expansion was never as great, so we asked people what their hospital meant to them and how we could improve their experience. We listened carefully to the voices of Milton, its town council and citizens, blending their thoughts with the insights of our staff, physicians, and volunteers. We developed a vision and a plan. The community rallied behind the project, with our friends sending the message that it was time for Milton's hospital to grow. The town committed $35 million, and the Milton District Hospital Foundation promised to raise another $30 million, which included $436,000 from the Milton District Hospital Auxiliary. And in 2011, we got the green light from the Ontario government to start building. With our project partner, Plenary Health, we got down to work right away. We kept to a tight construction schedule, breaking ground with the Minister of Health in the summer of 2015, marking the topping off of the project the next year, and completing the construction in the spring of 2017. Now we had to get ready to care for our patients. We tested, cleaned, and prepared every room and every piece of equipment, trained and oriented our staff, physicians, and volunteers, checked and double-checked, so that on October 1st, 2017, we'll be ready to provide care in the expanded Milton District Hospital. Thank you to everyone whose work on this project has helped us transform the community hospital experience. Thank you to the Milton District Hospital Foundation, Milton District Hospital Auxiliary, and to everyone who gave generously to make this a reality. Thank you for joining us on the journey to provide exemplary patient experiences at Milton District Hospital.
I personally think that should have been shown at the Toronto International Film Festival. Anyways, I am delighted this morning to be sharing the stage with such a distinguished lineup of speakers. And please join me in welcoming our first speaker, the Honorable Indira Naidoo-Harris. As MPP for Halton, Indira has always been a good friend of Halton Healthcare and a tireless supporter for our organization, and she always picks up the phone when I call her. And she's helped us navigate lots of different challenges and help us bring this project to fruition. So Indira, we're delighted you're here, and please give Indira a warm welcome.
Thank you, Denise, for that lovely introduction. Good morning, everyone. You know, I really can't tell you how pleased I am to be here with you all today, because this is absolutely a fantastic day. And it is so good to be here and be up here on the stage and get a chance to look out at all of you and see so many familiar faces, and so many of you that I know have worked hard and tirelessly over the years to make sure that we do this and that we get it right, because this is our community and our town, and you really care about what's happening here. You know, this is a special day for our hospital, our town, and Milton families, and I'm proud to be standing here beside all of you as we celebrate an incredible milestone for our community. Today, we open our brand new state-of-the-art hospital, and I'm honored to be joined by Premier Kathleen Wynne, the Minister of Health and Long-Term Care, Dr. Eric Hoskins, and our community partners to celebrate the conclusion of this vital project. I'm also thrilled to be here with my good friend, Milton Mayor Gord Krantz, Halton Healthcare President and CEO Denise Hardin, who I'm sure you all know works hard and tirelessly every day in this region for healthcare, and she has done such a great job on this project. I think she deserves a special round of applause. And of course, the hundreds of physicians, staff, volunteers, board members, and community leaders, you are all in the room, many of you are here, who have shared in this remarkable journey. I know how hard you've all worked, and I know your passion and dedication is deeply appreciated for this project. Today is an important day for Milton, and it's a significant milestone for healthcare in our community. But this is much more than a celebration of bricks and mortar. That's because this will be a place that will offer our family, our friends, and our neighbors a helping hand, a smiling face, and care when they are sick, vulnerable, and in need. And I know all of you in this room have a story about that. It's taken a lot of work to get here, but we are here finally, and it feels good, doesn't it? Absolutely. Over the years, as Milton expanded and this population grew and grew and grew, right, Mayor? It was clear the town needed a new hospital, and many of us joined together to make sure that our community got the quality health care facility we deserved. And you know what? It worked. In June 2011, I was honored to stand beside the then Health Minister, Deb Matthews, when she announced that the government was committing a massive $500 million. $500 million investment. Think about that in our community. That would change the future of healthcare in Milton, and it was a good day. Later, I was back here with Minister Hoskins for the groundbreaking and topping off ceremonies to celebrate the start and middle of the project. But this isn't just about steel and concrete. This is about our community, and it's about all of us being able to count on quality health care long into the future for our children, for our friends, and for our neighbors. And when the doors open to our brand new hospital on Sunday, I will stand proudly with my friends and neighbors as we celebrate together this amazing facility and the provincial investment in health care for our region. It is absolutely something to celebrate. And I will say thank you. Thank you to the Premier. Thank you to the Minister and staff for taking our request seriously and for making sure they made a massive historic investment in our town. $500 million is a lot of money, and we are deeply thankful to you for investing in Milton. This facility will stand as a reminder that when we all work together, great things happen. Now, I would like to introduce to you someone who I know is absolutely dedicated to the health and well-being of all Ontarians, a woman who works tirelessly for the people in this province and believes in investing in Ontarians and building them up. This year, Ontario committed to investing an additional $11 billion in healthcare, and this gives us more options, and it improves the quality of care we get in our province. Our young people will soon be benefiting from free prescription medications, free tuition, and thousands of childcare spaces. And all of that is because of our Premier. So it gives me great pleasure to have Premier Wynne here today to celebrate with us this remarkable accomplishment. Please help me give a warm Milton welcome to the first female Premier in the history of this province, Premier Kathleen Wynne.
Thank you, Indira. Thank you so much. It is it's such a pleasure to be here. What a wonderful occasion. And I have to say, I keep thinking about 6 o'clock on Sunday morning, when things will change in this building, and all the people who are going to be working, who are working here, are going to receive patients. So that is a wonderful. Going to be a wonderful moment, a busy moment, and I'm always fascinated by the logistics of a change like that. So thank you so much to every single person in this room. Thank you for all that you've done, because I know that there are people in this room whose stories, as Indira said, are not going to be told about your connection to this project. Indira is a ferocious advocate for Milton, and she brings your stories and she brings your energy and your passion to Queen's Park. And so I want to thank you, I want to thank her, because that is why this hospital has been built. That's why it has happened, because of this strong community. And I'm reminded, Your Worship, in the updating of the numbers, it's like one of those counters. It's just turning over, because when you drive into Milton, the neighborhoods that are being built, it's remarkable. It's like time-lapse photography, how quickly this community is growing. And I want to thank John and Lauren, thank you very much, and Denise, thank you, for the tour. And I said to them, I've been to a lot of hospital openings and hospital renovation openings around the province, and it's not usually the maternity ward that is the starting point. I'll be honest with you. In most of the places around the province, it's about seniors care and how do we provide better emergency care. But here, we started in the maternity ward because there's so many babies being born in Milton. So that is clear evidence of the growth that's happening in this community. So I'm just thrilled. It's an exciting moment, and it's great to be here. You know that you're growing faster than any other place in Canada, and so when Indira thanked me, it's really, these are your resources that are being reinvested in your community, because these are public dollars, and it is, for me, one of the definitional aspects of us as Ontarians, as Canadians, is our belief in and our support of publicly funded health care. I really believe that if we look at other jurisdictions, and particularly we look south of the border, the debates that go on, we have a different philosophy here. We decided years ago that we were going to work to look after each other, that we were going to pool our resources, and we were going to find a way to look after each other. So I think we can be very, very proud about our healthcare system. It's not perfect, I know that, but it is a very shining example of what happens when people make a decision to look after one another and care for one another. And I was just in the States, actually, and Danielle Martin, who many of you will know, healthcare advocate, was there talking with Bernie Sanders about publicly funded healthcare, single-payer healthcare. And I had the opportunity to do an interview with some American media who were asking me about, what about the wait times? What about the emergency room? How does it work? And I had the opportunity to talk about, because I'm 64 years old, and so my dad, who was a general practitioner, and my grandfather, who was a general practitioner, they both practiced medicine under a system where there was no publicly funded health care. And so my grandfather, who started practicing when he came home from the First War, so he was practicing in the 20s until 1952, he would tell stories about people leaving baked goods on the front step because they couldn't pay their bills. And when I first ran for office, I knocked on a door in my constituency, and the woman who I came to know had worked in my grandfather's office. He practiced in his home in North Toronto, and she realized that he had taken her in to do some office work because their family couldn't pay the bill. And so she was able to work off the bill by working in his office. And my own dad practiced starting in 1952, so he was there as we went through the transition in 1969, 1970. And I can tell you, you ask him, he's 91 now, and he'll tell you it made a world of difference once people didn't have to worry about whether they were going to be able to pay their bill or not. So on a day like this, when we are celebrating what we've all been able to do together, I just want to congratulate you, congratulate this community, wish the best of luck to the people who are going to be working in this wonderful new facility. And, being able to have services closer to home, my understanding is that twins will now be able to be born here, and there'll be lots of twins born in Milton because you're having babies and growing. But that means that moms don't have to go far away from home. And if you have to leave your baby in the hospital, as I did when my firstborn was born and he had a little bit of jaundice and he had to stay under the lamp, you're close to that baby and you can get there in a matter of minutes, and it makes a huge, huge difference. So I'm very grateful to all of you for what you've done to make this happen. This is a wonderful, wonderful day. It's a wonderful facility, and thank you. All the best of luck. Merci. I was supposed to throw it. I do that, The trouble is I don't use the notes, and then I make a mistake. I'm sorry. I knew as soon as I sat down, this is way too quiet. Nobody's jumping up. So I have the great pleasure of introducing and calling to the podium my friend, our Minister of Health and Long-Term Care, and a man who understands what it means to care for people in their most vulnerable moments. And Eric Hoskins is a huge champion for every Ontarian who at one time or another is going to need to walk through the doors of a hospital, is going to need to find the health care that their families are seeking. So please help me welcome Eric Hoskins.
Well, good morning. Denise was supposed to introduce me, but I really enjoyed that. I don't think I don't get introduced by the Premier very often, and so thank you for those kind words. But so this is a great day. This is my third time. I was here for the groundbreaking. I was here for the topping off ceremony. I don't know how you snuck that in. I didn't even know that was a thing. And in fact, you can, I think, appreciate with the Premier's commitment to capital investment for hospitals. We're investing, all of us as a province, we're investing $20 billion in hospital capital over the next decade. And this, of course, as Indira mentioned, approximately $500 million investment by the province, alongside, and thank you, the many, many donors, particularly the auxiliary. What was the amount? It was $500,000, I think, from almost $500,000 from the auxiliary. I am always blown away by the volunteers and the auxiliary and the the community donors, the amount of passion and compassion and commitment and hard work that goes into building an edifice like this. It really is it's those individuals that on a daily basis, forget when you're building a new building, but even on a daily basis are so committed to our hospitals and our healthcare facilities, and I want to thank you for that. So the topping off ceremony, those of you who were, Denise knows this, and those of you who were there for the topping off, so it was a big steel beam, right, which is, the cranes were ready, in fact, lifted it up to it was the highest point in this 4-story building, and so we had the opportunity to sign our names with a Sharpie just before it was taken up to the summit. And Indira and I had a few extra moments, managed to sneak in a game of Sharpie tic-tac-toe on the beam. So I'm not supposed to, it's too late, it's known. But the other thing about Indira I want to say is, so she was my director of communications when I first started in immigration, the Ministry of Immigration, and I have to, I'm so proud to have that long history with her, and to see the level of contribution that she's made as an MPP. But even, and that would have been in 2009, even way back then, long before she was an elected official, she was advocating for and committed to the building of this new hospital, this expansion here in Milton. And you need to know that she has been absolutely relentless from that podium as Director of Communications to a minister herself through that whole period of time, has been absolutely relentless in championing every possible aspect of healthcare here in Milton. You have a tremendous champion in her, and I'm so glad to be sharing the stage with her, and of course with the Premier as well, that her commitment to healthcare is so substantial every single day, and it's reflected in the level of financial commitment that we're making to healthcare, the capital investment that I mentioned earlier, the increase in the healthcare budget, but I want to reference particularly one aspect that she touched on briefly, and that's OHIP Plus, which is a pharmacare program for every single Ontarian under the age of 25. And the leadership that she's demonstrated in that, and the impact that that is going to have on 4 million Ontarians come January 1st, let alone their parents and their families who will benefit from a drug program that is absolutely free, with no co-payment, no annual deductible, no upfront costs. And it's her leadership on issues, not simply capital investments, as important as they are, but it's other aspects of the healthcare system which really aim to focus on making life a little bit easier and a little bit better for Ontarians, and particularly to give those young Ontarians a better start in life, and a more equitable start as well. And so lastly, I just simply want, because we can talk about, and I'm still trying to figure out why it's called, there's a beautiful mural and photograph of Hilton Falls. I'm trying to figure out why it was Hilton and not Halton Falls. I'm sure there's a good reason for that. But this is a beautiful, beautiful building, so you should all be so very, very proud. It's inviting, it's warm, it's conducive to healing, it's got the latest state-of-the-art technology, and it's got, amazingly, a brand new MRI as well. So anybody who's ever had, anybody who's ever had to travel, I guess probably to Oakville for an MRI, you and your family members, your friends and colleagues are going to have that important service close to home. So I'll end simply by thanking, and the mayor, it goes without saying, the mayor has been an absolute there are so many people, but the mayor deserves particular credit for his extraordinary commitment to this town, and you're still called a town, right? Yep. Okay, I'm thinking not for long, and probably, I was getting increasingly concerned when Denise was talking about the population increase, because I figured I'm probably going to be back here very soon with another hospital announcement at that rate. And I know that you have a champion and a great friend in the mayor with regards to healthcare. So, ladies and gentlemen, Denise, it goes without saying, your team, your dedication, the doctors, the nurses, virtually every staff, because they all play an equally important role in running a hospital. Everyone is equally important. The volunteers, the donors, thank you so much for the leadership that you've demonstrated, and congratulations. In 45, I think, short hours, this is going to be a live, vibrant place, healing the people from this area and from the entire Halton area. Thank you.
Thank you, Premier Wynne, Minister Hoskins, and Minister Nadeau-Harris for first and foremost taking time out of your busy schedules to be here with us today, for helping us celebrate the culmination of many, many years of hard work to bring this amazing project to fruition. And most importantly, thank you for the ongoing support of this provincial government to recognize the need to fund expanded healthcare infrastructure, not just here in Milton, but in Halton region. So thank you very, very sincerely for your commitment to supporting us. Before I introduce our next guest, I would like to just make a call out to a couple of key other dignitaries who are here in our audience. We have Mayor Burton from Oakville, Gary Carr, our regional chair, and many of our town councillors are here, and our CAO for the town of Milton, Bill Mann. So a big warm welcome to all of you. And thank all of you for your ongoing support. So the man who almost needs no introduction, who all of you know, I am about to introduce, and make sure that you know he is the longest continuously serving mayor of a municipality in this great country of Canada. And he is a true champion of our hospital and Halton Healthcare as an organization. So without further ado, Mayor Gord Krantz.
Well, Madam Chair Denise, thank you very much, and Madam Premier, again, a great big Milton welcome. Minister Hoskins, Minister Nadeau-Harris, my MPP, by the way, a great big welcome. And Minister Hoskins, you had mentioned there before about, is it still the town of Milton? It's still the town of Milton. And we've been avoiding that city status for some time. As my colleague, Mayor Burton is still the town of Oakville. And Milton's population is roughly 130,000 that was mentioned. And I think Oakville right now, Rob, is probably 180. But it's still the town of Milton, 200,000 now, town of Oakville. Still the town of Oakville. So it gives you that image that we're still a small community, even though we're growing constantly. And Madam Premier, ministers, you should be aware that it's not going to stop here. Just Monday night passed, as a matter of fact, we were dealing with into the future to 2031 and 2041. I'm not sure who coined that famous phrase, you ain't seen nothing yet, when it comes to this community. Madam Premier, again, I want to thank you and your government for what they did with Deb Matthews and making that announcement. You don't know how critical that was to this community to hear those words that the hospital was going to be expanded and the funds were going to be committed. Now, there's always a risk of singling individuals out, but that never ever stopped me before from doing it, and it's not going to now either. And of course, two of my colleagues at the regional level, Mayor Burton and also Regional Chair Gary Carr was mentioned. Not only am I the mayor of the town of Milton, but I'm also a regional councillor as well. So we're a big family in the region of Halton. And I know, Madam Premier, you even have a bigger family. It's called the province of Ontario. So I'm just as interested and just concerned about the well-being of those other three communities as well. So that's where healthcare certainly comes into play. Also, I really would be remiss if I didn't single out the Friends of the Hospital. And I know there's a few of you here. Give a little wave. See? Madam Premier, they led the charge on getting things moving back some years ago. And also, there's another individual that I'm going to single out, and I couldn't miss someone, but Brian Penman. Brian, give a little wave there as well. I know he chaired the fundraising committee, and I think you had a co-chair as well, Brad Grant, I believe. But they raised that $30 million, and I think on time and on budget there as well, to Brian. I heard you say that more than once, and of course, Madam Premier, I'm a strict advocate of on time and on budget as well, so they did that here. Last but certainly not least, it's the people that contributed, and I know there's a number of you in this audience here, and I'm not going to single you out, but some of you made some significant contributions to make this happen, and that probably made Brian's job just a little bit easier. But I know he had to get out there right up to, I think, about the last minute and shake the bushes to get that last dollar for to make his... Not done yet. Not done yet, so still more to come. But anyway, as well, the doctors, the nurses, the administrators that make this great facility happen here in this community. So I just want to say thank you very much. And Madam Premier, you heard me mention before about capturing the moment. I know that you're on a pretty strict schedule, but we're not going to hold you up. But capturing the moment is what it's all about. And there's a great big red ribbon in there and scissors, and I'm familiar with some of those. That's called capturing the moment. And we're going to do that in just a very few moments. But Madam Chair, back over to you. Thank you very much, ladies and gentlemen.
Thank you, Mayor Krantz, and thank you again to the town of Milton, all the councillors, for your unrelenting support, and to Bill, our town CAO, and your team for helping us navigate so many aspects of the projects with permitting and such. So to our town of Milton, 35 million thank yous. And now I would like to introduce our very own board chair, Mr. John Nyholt.
Thank you, Denise. Today is indeed an historic day. It is a dream realized, marked by the completion of an expansion project that means so much to everyone in this room and in our community. And as I stand in this magnificent main lobby, I think you will agree that we have truly fulfilled our vision for this project, which was to create with and for the community a distinctive center of healthcare excellence that provides, through the efficient use of resources, the highest quality of clinical patient-centered care with an innovative environment that supports the physical, mental, emotional, and spiritual needs of the community. This vision stood the test of time and has been our touchstone as we move through the many milestones of this project. Congratulations to Denise, who as President and CEO provided strong and steady leadership and oversight of this project. And to Bill Bailey, our Vice President of Redevelopment, who so skillfully led the redevelopment team that delivered the project on time and on budget, never mind the distraction of that other new hospital of ours in Oakville. And to Janet Skupski, our Chief Operating Officer of Milton District Hospital, whose attention, yes. You have a few fans in the room, Janet, so your attention to detail is so evident throughout this beautiful facility, and it's a real testament of your commitment to this community. And although I've chaired the Capital Planning Advisory Committee that oversaw the construction of this new facility, I've only just started my term as board chair. This project has been a key focus of our board for some time, so I would be remiss if I did not thank those who came before me as past board chairs. Their wisdom and relentless dedication to this major expansion project helped so much to make this all possible. So a special thank you to Murray Payton, Mary Davies, Mag Shorley, John Fleming, I see, Judy Wilson, and I thought I saw Lorenzo Bionde back there as well. Thank you all for your dedication. And of course, I would like to acknowledge our partnership with the Ministry of Health and Long-Term Care, Infrastructure Ontario, Plenary Health, including our constructors, PCL, who all came together to build a facility that has raised the bar for hospital construction and design in Ontario by combining innovative architecture and the latest in technology to deliver high-quality patient and family-centered care. And finally, the town of Milton, the Milton District Hospital Foundation, and the Milton District Hospital Auxiliary, and others too numerous to mention, everyone working together, doing their part to make all of this happen. On behalf of the Halton Healthcare Board of Directors, I extend our sincere thanks for your dedication to healthcare in Milton and for helping us transform the community hospital experience. Thank you.
Thank you, John. As you heard, John's had to serve double duty on this project, so we really appreciate his strong leadership as well. And last but not least, I'd like to invite our very own Chief of Staff to speak today, Dr. Lorne Martin.
Thank you very much, Denise. I am very honored to be a part of today's ceremony. There are a couple of people I would like to recognize as well. And first of all, Cindy Luna, who's been a board member with Halton Healthcare's board since 1997 when the Oakville and Milton hospitals came together. And you've been a tireless advocate for the Milton Hospital through that process and a big part of this project as well. And also Dr. Jane Wilkinson, who's led the clinical planning team in partnership with Janet Skupski and really brought the whole clinical plan together. So thank you very much. So it's only 2 more days before we open the hospital. It's a very, very exciting time for us. This expansion will radically transform the experience of our patients, our families, and our staff. And patients in particular are going to benefit tremendously from the privacy, the comfort, and the healing environment that the architects have worked so hard to provide in this facility. As an emergency physician, I'd like to speak to what this new space means for me and my colleagues, and for my colleagues in all of the other disciplines that will be practicing in the new facility. So emergency medicine takes place under intense pressure, and we experience very challenging conditions. And the place that you work in can really affect the care that you deliver. And the new emergency department really does address that. It's been very carefully designed to empower us to work efficiently, to create an environment where the physicians can use their skills and talents to their fullest. And we have all of the latest and greatest equipment, which has been said. It's right at hand, and we can manage even the most difficult resuscitation in this new environment. The rooms themselves are carefully designed. We have all the life-saving equipment. But we also, at the same time, because of the way we have all private rooms, because of privacy glass, which protects the privacy and dignity of the patients, it's also going to be a very comfortable space to provide care and to receive care. But the transformation doesn't stop in the emergency department. The expanded hospital also puts very powerful diagnostic tools in our hands. For example, Milton's first MRI, which you've heard about. MRI is becoming the standard of diagnostic care. It is a very safe type of study. There's no radiation involved, and it provides absolutely the most detailed images of the inside of the body. And it really does allow us to make rapid and accurate diagnoses in emergency situations, but also it's become crucial for managing the whole range of musculoskeletal problems, sore knees, sore hips, et cetera. So this is really bringing us up to a standard of care here in Milton. We have state-of-the-art operating rooms, wonderful space, all the latest monitoring equipment, infection control, negative pressure. We have a new special care nursery, which you've heard about, which is going to really lift the care in Milton, prevent us from having to transfer sick babies out. We'll be able to care for them here. We have specially designed ambulatory and day surgery rooms. So we're really poised to deliver on that Halton Healthcare and Milton Hospital promise to transform the community hospital experience for you. So whether it's resetting a fracture, delivering the newest member of your family, helping you live well with chronic disease, or supporting you as you face a life-threatening condition, as we may, now more than ever, our talented nurses, physicians, and therapists from many specialized disciplines are ready to care for you. So thank you very much. Thank you, Premier, Minister, Denise, Mayor Krantz, Board Chair. Thanks, everyone.
Thank you, everyone. And that does conclude our formal remarks for this morning, but we haven't finished yet. We now have the grand finale, the actual part of the event where we actually cut some ribbon, my favorite part, and gourds too, apparently. So just a few remarks, and then we'll get organized up here on the stage. The simple act of cutting this ribbon is the sum of the efforts of thousands of people, including the provincial government, the Ministry of Health and Long-Term Care, the Mississauga-Halton Local Health Integration Network, the Milton District Hospital Foundation, the Town of Milton, the Milton District Hospital Auxiliary, our donors, the Friends of Milton District Hospital, and of course, our very own staff, physicians, and volunteers. We are all united to create a center of healthcare excellence to serve the people of Milton, not just for today, but for decades to come. And all of you have truly proven that it takes a whole community, not just to raise a child, but to expand a hospital. So congratulations. So we're now going to invite a few other distinguished guests up onto the stage to join in the ribbon cutting. So first, Mr. Brian Penman, as you heard earlier, who's chair of the Milton District Hospital Foundation Board. Brian, if you can come up and join us. Bona Richmond, who is the president of the Milton District Hospital Auxiliary. Aaron Corey, the president and CEO of Infrastructure Ontario. Mary Davies, who is currently the vice chair of the Mississauga-Halton LHIN and a past board chair of Halton Healthcare. And what we're going to do on the stage is get organized to cut the ribbon. So we're going to do that, and we're going to allow a few moments for photo op, and then we're actually going to cut the ribbon, but I'm in charge of the timing of when we cut the ribbon. I've had some experience with this now. So we will cut the ribbon. I'm going to count down 3, 2, 1, and then we cut on 1. But first we're going to line up, and we have some very, very sharp scissors. So It's my responsibility to make sure we manage risk, and if you can carefully handle the very sharp scissors, we will get everybody organized. And while we're doing that, so you can come up and we'll get everyone organized. Just a reminder, we have opportunity for all of you to have your very own ribbon cutting memento. So we have our photographer over here to my left, who is here to enable you to come and with your group of friends on your own. Maybe you can get the Premier in your picture, I don't know, but it's your opportunity to get your very own ribbon cutting memento, okay? All right.